to let you guys know what the progress is or what's happening. And it's been a long time since I put the last one out, and I can't remember how long actually. I need to look at those on YouTube. But since January, I've been seeing a pain management doctor because everybody else has given up. They don't know what to do. For the first 2 months, we tried everything, and I was even getting a nerve block shot right here in the jaw, which is just the most painful thing I've ever done in my life. And that would work for about a day. That it would help, basically help numb it, I guess you would say. But it only did it on the side, so it only come to here. And for you guys that don't know what a trigeminal nerve is, it's the nerve that runs. There's one that runs here, across the forehead, or across the nose, and across the forehead. We're deadening this one, which is the one where my lips burn and whatnot. I did get an oral surgeon to cut this piece off again and him do a biopsy on it at the University of Florida Hospital. And it came back the same way, nothing. It's like your body's, it's like a callus or something. It's weird. But he seems to think that the denture adhesive has caused this. So if you're not familiar with that, denture adhesive overuse has just come under fire, and there's a class action lawsuit against the manufacturers of Fix-A-Dent and several other manufacturers with over. If you, best way to put it is your body needs so much zinc a day, which I would say I think it's 5 to 10 milligrams, and if you're taking so much denture adhesive, it could be up to 300 milligrams or 3,000. I can't remember. It's a lot, but he seems to think that's what it is, and it's called permanent. It's caused permanent damage to my mouth and my nerves in my face, and that's what could be causing it. So that's a professional opinion, and Mayo Clinic, they couldn't figure anything out. I've been to Mayo Clinic too since January. I don't know. I've done a lot of research on the hybrid implant, the one-piece implant. Dr. Norman Kwan is a doctor up in Canada. He's got several offices, which I can't fly to Canada. But he seems to be, I think he invented this one-piece implant, but it's just the teeth part. There's no palate, there's no gum material, it's just the teeth. And they said about a millimeter or so above the gum, and one person showed me that too, one of the viewers. I looked up, and I think you can look it up under bionic teeth. And his name is Dr. Norman Kwan, K-W-A-N. And I think he invented it. Anyway, he calls it, or it's called bionic teeth. And down here locally at my doctor's office, my oral surgeon, he calls it a hybrid implant. The hybrid implant that he makes compared to Dr. Kwan's, they look similar, but his has got the one down here and locally has a little more gum material that I don't really want, and it's the same price. So they're around 20 grand. It's a third, if not a quarter, of what normally an implantation would cost for every tooth. But I can't afford that. I haven't worked since July. I lost my job in July due to this economy, and I haven't found one since. But I think what I'm looking for now is if anybody knows anyone out there, or a doctor or a dentist sees this. Oh, and by the way, I was on the local news. I don't know if I mentioned that. About the denture adhesive. So there is a big lawsuit about it. The reporter told me that he didn't think that anybody would come forward and say anything about it, and I'm like, I will. So I went on camera. I'll try to find that video and post it on the news, or from the news on YouTube, so you guys can see it. What I guess I'm looking for now is, I almost went as far as to set up some kind of donation site or something like that you could donate to me, or if you're a dentist, you can donate it your time, and I would try to dig up the money to pay for lab costs if I can. Anything I could do to get my bottom teeth and my top teeth screwed back to my head would be so much better. The one thing that I will say that to anybody, because I've had several family members even say that they were thinking about doing this on a voluntary basis like I did, I will tell you it will be the biggest mistake of your entire life. If you voluntarily pull your own teeth just to look better, or you don't like yours, or you're tired of dealing with them, deal with them. I would rather have my little teeth back. Mine were just little. I didn't have meth mouth or any crazy stuff. I would rather have my little teeth back than to be going through this awful agonizing pain and it take over your freaking life. It is the most dumb, it's the dumbest thing I've ever done. And I'll repeat myself 100 times for that, I'm sure. I will not recommend this to anybody, especially the bottom teeth. If you are going to do something, do not do them all. Do the top only, or don't do it at all, because it's just not worth it. If you've got a few teeth missing, get a partial. I'm telling you, it just, that's my personal opinion. You see how long I've been going through this. It'll be 3 years in November. It is awful. I did notice something. I'm not using as much as this anymore as I was, but I still have jars laying around, and I just don't know anymore. So if anybody's got any ideas on, getting donations for me, or sending me somewhere that they have a dad or something that could help me, or a family member, uncle, I'll do anything. I'm in Tennessee a lot. That's where I'm from. My wife's from Tennessee. We go there, we visit. I'm 5 hours from Atlanta, and I can be in Orlando in 4 hours. So I can call it 3. So that's the only options I've got now. I would, like I said, I would try to scrape up at least enough money to pay for lab costs. If there's a learning hospital, would be fine with me too. But if anybody's got any ideas out there, please let me know, because I just want to get back to my normal life. I appreciate it, and I'll keep you guys posted, and I'll look for that video too. Thanks everybody, and I'll talk to you soon.